15 reasons for leg pain. From a simple imbalance in the body's salt levels to a disc issue in the lower back or a hernia, there are numerous factors that can cause leg pain. Therefore, it's helpful to observe other symptoms accompanying the pain to aid in identifying the issue and understanding how to address it. In this video, we outline the top 15 causes of leg pain and their treatments, including what you can do at home and when it's time to seek medical attention. However, remember, if you're uncertain about your health, it's always best to consult a trusted physician for an accurate diagnosis and appropriate treatment. But before we delve deeper, don't forget to subscribe to our channel and enable notifications to stay updated with our posts. Number 1. Lack of salts in the body. Salts like sodium and potassium are present in our blood and bodily fluids, aiding in various functions, especially muscle function. However, when we exercise excessively, we lose many of these salts through sweat. This can lead to leg cramps or a sensation of tingling or weakness. This issue can also arise due to certain medical treatments, such as chemotherapy. To prevent this, it's advisable to consume beverages containing salts or eat foods rich in potassium and calcium. If you experience frequent cramps, it's best to consult a doctor to rule out any other underlying problems. Number 2. Deep vein thrombosis (DVT), where a blood clot becomes lodged in a vein in the leg or muscle. This is known as deep vein thrombosis, which typically causes swelling and pain in the affected leg. Some individuals may not feel anything, while others may experience significant swelling, increased warmth, and redness in the leg. If you experience these symptoms, it's crucial to see a doctor for medication that can help dissolve the clot, as it may potentially travel to the lungs and cause serious complications. Number 3. Arterial issues in the legs, where the arteries that carry blood from the heart to the arms and legs narrow, primarily due to the buildup of fats and cholesterol, forming plaque on the inner walls. This condition is known as peripheral arterial disease, PAD. This narrowing makes it difficult for blood to flow, especially in the legs, potentially causing severe pain if left untreated promptly. This lack of circulation can lead to tingling, pain, cramps, and even changes in skin color. Without sufficient blood, the tissues in the leg can die. In severe cases, amputation of the foot or leg may be necessary. The doctor may prescribe medication to help with the problem and pain, but often surgery is needed to improve blood flow. Number 4. Damaged nerves in the legs. Peripheral neuropathy occurs when the nerves that send sensations from the legs to the brain are impaired. This can be due to medications used in cancer treatment, a strong impact, or diseases that affect these nerves, such as diabetes. These nerves function to perceive and transmit sensations to the brain. So, when damaged, they can cause incorrect sensations such as burning, tingling, numbness, weakness, difficulty sensing heat or cold, and intense pain. If diagnosed with this condition, treatment may include medications for depression and pain creams, as well as addressing any underlying disease causing the problem. Number 5. Spinal stenosis. Spinal stenosis occurs when the space within the spinal column becomes too narrow, putting pressure on the nerves located there. This pressure can injure the nerves, causing sensations of tingling, numbness, weakness, and pain in the legs, and in some cases, difficulty maintaining balance. If you are experiencing any of these symptoms, it's important to speak with your doctor. They may prescribe medications to alleviate pain and recommend physical therapy to help resolve the issue. But if these measures are not sufficient, surgery may be necessary. Number 6. Joint inflammation. Rheumatoid arthritis is a disease that affects over 21 million people worldwide and is a common cause of leg pain. It occurs when the joints become inflamed, leading to pain and stiffness. When arthritis affects the ankles, hips, or knees, it can make walking or performing daily activities very difficult due to pain. Unfortunately, there is no cure for arthritis, but maintaining a healthy weight with exercise can help reduce pain. Using heating pads or applying ice to inflamed joints can also alleviate pain and inflammation. Number 7. Stress fracture. If you experience pain or cramps in one or both legs after exercising or playing sports, and this pain persists even after a day, you may have a small crack in the shin bone known as a stress fracture. This happens when the muscles around the bone are used so intensely that they can no longer absorb the impact of movements as they should, causing a crack in the bone. The best way to treat this is by resting, which can take from 6 to 8 weeks to heal depending on the severity of the fracture. It's important to wait until fully recovered before returning to exercise to avoid worsening the injury and needing more time to recover. Number 8. Varicose veins. Varicose veins occur when the veins widen or become inflamed, causing them to appear purple or dark purple. Usually, varicose veins are not serious for most people. However, they can cause discomfort, cramps, heat sensation, and pain due to circulation problems. Treatment typically involves wearing compression stockings and engaging in plenty of exercise to help blood circulate and prevent vein inflammation. Additionally, prevention is one of the best forms of treatment, so try to avoid standing or sitting for long periods and manage your weight. Varicose veins tend to appear more with age or during pregnancy, situations where the doctor may suggest other ways to relieve pain. Number 9. Tendinitis or tendon pain. Tendons are like ropes that connect muscles to bones and can cause a lot of pain when inflamed, making it difficult to move the joints. This is called tendonitis, an overuse injury that often affects the hip, knee, or ankles, causing pain that can extend down the leg. To treat tendonitis, resting is essential, and pain relief medications like aspirin or naproxen can be used. You may also receive injections to reduce inflammation and alleviate pain, and even platelet-rich plasma injections to help the body recover faster. Number 10. Muscle injury. If you overexert yourself or lift something too heavy without warming up your muscles beforehand, you can stretch them to the point of tearing. This type of injury is very painful, and the pain starts immediately after it happens. If this occurs, don't worry. It's quite common, especially among frequent athletes. The most important thing is to apply ice to the injured area immediately, gently pressing for about 20 minutes or until you feel relief from pain and swelling. After the pain subsides, wrap the injured area and keep it elevated if possible and rest. You can also take over-the-counter pain medication to help. Number 11. Muscle cramps occur when a muscle contracts so strongly that it causes terrible pain, and you may even feel a hard knot of muscle under the skin. They can arise from overuse of a muscle due to strain, prolonged time in the same position, or inadequate hydration. Additionally, cramps become more common as we age. The good news is that most of the time, muscle cramps go away on their own and are not a serious health problem. However, if you experience cramps frequently, it's worth discussing with your doctor. Number 12. Shin inflammation. The shin bone is the large bone in the front of the lower leg. When we exercise more than usual and use many muscles in this area, the tissues around the shin may become inflamed, causing significant pain along the inner edge of the bone. This type of pain is more common in those who run frequently, or individuals with flat feet, very high arches, or who do not wear the right type of shoe for their foot. To treat it, applying ice to the painful area for about 20 minutes or using pain relief medication may be helpful if necessary. Number 13. Thigh pain, due to nerve compression. Myalgia paresthetica occurs when the nerve that carries sensation to the skin of the thigh is compressed, causing burning pain, tingling, or numbness in the upper thigh. It is more common in pregnant women, individuals who wear tight clothing, experience rapid weight gain, are obese, have experienced trauma in the area, or have certain health conditions such as diabetes. Discomfort usually improves with simple remedies like ibuprofen or acetaminophen, but if the pain persists for more than 2 months, it's important to consult a doctor for more specific treatment. Number 14. Sciatic nerve pain. Sciatica is pain that originates from the sciatic nerve, which runs from the lower back through the hips and buttocks and down the leg, typically affecting only one side of the body. This pain can occur when someone has a herniated disc or another spinal problem that compresses the space through which the sciatic nerve passes, causing pressure, inflammation, numbness, and pain in the affected leg. The intensity of the pain varies, sometimes becoming so severe that it makes standing or sitting difficult. It's important to seek prompt treatment with physical therapy and pain medication, as in severe cases, surgery may be necessary. Number 15. Sprain. Sprains are injuries to ligaments, which are the fibers connecting two bones, caused by stretching or tearing. The most common cases involve the ankle, where a sprain causes swelling and tenderness, making it difficult to use the affected limb. To care for a sprain, start by applying ice wrapped in a towel to the injury for 20 minutes per day or until the pain subsides. Then, use a compression bandage and rest extensively. If the pain persists, it may indicate a fracture, and in such cases, it's essential to seek medical attention for examinations such as X-rays and initiate proper treatment for the fracture. To treat leg pain, especially after a sports injury or physical trauma, follow these steps. 1. Ice application. Place an ice pack on the affected area for at least 20 minutes, or until the pain diminishes. This will help reduce swelling and pain. 2. Immobilization. Use a splint to limit movement of the injured area during the first few days. This helps prevent further damage and aids in initial recovery. 3. Elevation. Keep the leg elevated above the level of the heart. This reduces swelling by decreasing blood flow to the injured area. 4. Gentle exercises. After improvement, engage in light exercises as recommended by a physical therapist to restore mobility and strengthen the legs. 5. Seek medical attention. If you suspect a circulatory problem causing the pain, consult a doctor immediately for specific treatment of the condition. 6. Preventive measures. To avoid future leg pains, weight loss reduces pressure on the legs. Quitting smoking improves blood circulation. Controlling blood pressure and blood sugar reduces the risk of conditions affecting leg health. Regular exercise keeps circulation active and prevents cramps, and a healthy diet consuming potassium-rich foods like chicken and bananas can prevent tendon injuries. To alleviate pain, apply ice and rest to reduce inflammation and discomfort. Take over-the-counter pain relievers like ibuprofen or aspirin. Use support stockings to improve circulation, and do stretches after a warm bath. Seek medical attention if the pain persists for more than a day, there is swelling in both legs, or pain while walking. For severe symptoms like fever, warm and red legs, or difficulty breathing, seek urgent medical attention. To prevent leg pain, stretch before and after exercises and maintain a healthy lifestyle with regular exercise, controlled weight, and good nutrition. Now, you're familiar with the 15 most common causes of leg pain, the treatments you can undertake to address them, and when you should consult your trusted physician for a timely evaluation. We hope this video has been helpful. If you have anything to add, please share it with us in the comment section. Like this video and share the link with your family and best friends so they can also learn about the most common causes of leg pain. If you're new to our channel, don't forget to subscribe to keep learning. See you in the next video.